Welcome back to the KUSI News at 5. I'm Alan Denton.
And I'm Anna Laurel. Sandra Moss has the night off. Thanks so much for joining us, everybody. An annual report on suicide prevention in San Diego County is focusing on what can be done to prevent suicide among teenagers.
KUSI's Sasha Fu is here with more on that story. Sasha?
Alan and people are seeking help. That is one of the findings in this annual report, which brought educators and mental health specialists together today to talk about preventing suicide among children and teens.
Suicide does not only affect the individual, it's also a crisis for the community.
What the data shows me is that it's time for us as a community to really come and realize that we all have a role to play.
That's the message behind the release of the 2018 report by the San Diego Suicide Prevention Council. And this year, the council is taking a closer look at strategies to prevent suicide among teens.
There's a ton of research that shows that talking about suicide is the only way that we'll ever prevent it.
Overall, for all age groups, the county's suicide rate from 2016 to 2017 is up by 5%. Compared with suicide rates among all ages, the number of teen deaths is relatively low. But addressing mental health problems early can prevent suicides later.
And what we know is that a previous suicide attempt increases the risk of a future attempt.
Stan Collins, who works with the Suicide Prevention Council, says school districts across California are actively involved in creating prevention policies so that all school staff can be trained to recognize the signs of someone who may need help.
Usually when I talk to somebody and ask them, are you thinking about suicide, it's almost like a pressure valve gets released and it's like, oh my, I can finally talk about this. So we really encourage people not to hesitate to talk about it. It's the only way that we'll ever prevent it. That shows that talking about it doesn't put the idea in somebody's head. So the only way we'll ever know what type of help someone needs is by being direct.
With a new state law passed in 2016, all California school districts must have comprehensive prevention policies for grades 7 through 12. Jade Ferrero, who attends Mountain Empire High, says she's learned that students can help each other.
If you continue to ask and thoroughly say, like, are you okay? Do you need help? And offer them services, they will get better.
Dr. Cheryl Rohde, a psychologist at the San Diego Center for Children, says teens with behavioral health and emotional problems have a higher risk of suicide.
And so if youth are not getting help for those emotional problems, then they're more likely to get stuck. So if someone is expressing, I can't fix this, we want to take that as our first kind of warning sign.
Serious problems with anger and mood, isolation from friends, and pulling back from normal routines are also signs that someone needs help.
When our kids are not doing those things, it should be a red flag, and it's time for parents or other concerned adults to reach out and to say, I'm concerned. What's going on? What do you need?
Now, we should note that more people of all age groups are seeking help. Suicide-related calls to the local crisis hotline rose to an all-time high in 2017. They made up 31% of all the crisis calls. If you or someone you know is in need of help, you can call that Access and Crisis line. It's manned 24 hours a day. It's 888-724-7240.
And Sasha, it's so sad to think that even younger students are thinking about something like this. Is there suicide prevention for them?
Yeah, there is. Actually, it is kind of shocking to think that children 5, 6, 7 years old are thinking about suicide, but we are hearing that 21 of the 36 school districts in San Diego County had K through 9 grades participating in special training in 2017. That is almost 60% of the districts in this county. Now, the state legislation we referred to only requires suicide prevention policies for grades 7 through 12, but a lot of districts apparently recognize the value of having a prevention policy and staff training to help students even earlier, even when they're still in elementary school.
Yeah, starting young, they need.
Exactly.
Yeah, that's key. All right, Sasha.